Hi guys, welcome to the AAFE Training Center. I'm going to show you a treatment on my patient here. We did do a little bit of lip filler. As you can see, this was her second treatment in a year. So last time I treated her with a little chin, cheeks, and lips was last May. And here we are again in April, and I'm just kind of touching everything up for her. She wanted a little bit more lip, and I said in order to do so, we should support with some cheeks and chin. So that's what we're doing here. So as you can see, I have her slightly opening her mouth, and I'm also just keeping my fingers in the same area the entire time, just to make sure I'm not coming off of bone. And I also am just going in down to bone. I'm having a good solid aspiration. Very slowly, I'm pulling back to the point 1 and making sure that there's no blood in the hub. And then I'm giving no more than 0.1 at a time for safety reasons. And I'm really pinching the tissue. I like to do this because it helps with some stability. So that's why you can see with my left hand, I'm really helping to do that. Even though I have poked her a couple times during this treatment, I really do not like to do more than 0.1 at a time. We teach this in our level 3 dermal filler course, and we call it the injection perfection protocol, which is just ensuring that you're down on bone, you're steady, you're aspirating, you know your depth. We did ultrasound prior, which I'm a huge fan of, and we have an entire course on that alone. So that way I could just kind of see her arteries and make sure they are where I expected them to be. Because worst case scenario, if I saw something I didn't like on ultrasound, I at least could have known ahead of time. So here I am, I just check cap refill after every injection point and I reevaluate. And for her, I gave her a lot of filler immediately. I didn't do much laterally just because she had a little deviation or divot in her chin that she wanted filled. So I kind of addressed the medial portion the most, which is ideally what I liked on ultrasound the most too, was staying medially. So you can see just going in, aspirating, giving a little bit at a time. I mold and shape. I did pick a pretty heavy product to kind of mimic bone, especially given the area of the face. So it's not going to be super easy to mold, but I just like to move the tissue around, make sure it's pink, it's got good blood flow. Because as you guys know, this is a higher risk area. So I just want to be as safe as possible, careful, and go slow with it. And if you feel comfortable, coming back and seeing the patient back and just doing little bits at a time, that's perfectly fine. But considering this wasn't our first chin treatment on her, I felt comfortable giving her a little bit more in this one sitting. You can see I gave her just a baby bruise there on the chin. And a good way to be able to tell if it's a bruise or a complication is just checking cap refill. So here I am a smidge laterally, but I am still pointing that needle pretty medially. So even though I'm coming in from a different angle, it still is pretty medial on that chin. And I'm doing just a little bit more. And you can see, I've done almost a full cc just in the chin. Depending on if there's a deviation or how much projection is needed, this is not uncommon to add, a full syringe in the chin there. I just recommend doing it slowly and cautiously. And I definitely recommend having and being familiar with how to use an ultrasound. So just my 2 cents off of some experience. And you can see how much that just helps support her lip. It just really helped bring everything together and make your eye focus on her pretty lips now instead of the deviation that she really didn't like in her chin. So just taking a look overall, tissue looks pink. And then I always ask the patient too, you can see she has a mirror with her. We're just going back and forth, making sure she's happy. Looks great. Here I am with just 0.3 left in the syringe. So I popped a little bit in her cheek just because I noticed she needed a little bit more support in her under eye. And I wanted to just frame the lips even more so. So there I am, just adding 0.1 at a time. And then I'm going to do the same thing on the other cheek, and look how much that did. Just 0.1 was incredible on her cheek there. She really didn't need much, but we did 2 syringes a year ago, so she really shouldn't need that much more. We're just kind of maintaining at this point. We teach lips and we teach cheeks in level 2, just some different techniques. But chin and ultrasound use is level 3, and that's considered a very advanced treatment. So Here I am on my last 0.1, and I'm going in and just giving her a little bit more support to the cheek. And overall, at the end, she was extremely happy with everything. And I don't need to see this patient back for a while. I really am not a fan of doing too much too consistently. And of course, the last injection always has a little hematoma there and always wants to bleed the most. So overall, just taking a look at everything, and I'm very happy with how it looks. And that was, one syringe. Some patients might need more, some might need less. But she was super happy with it. And when they're happy, I'm happy. So we're just talking everything over, and that's kind of it. I'm just kind of putting some pressure on that bruise there too. Thanks for watching.